Hi, thank you all for joining us. This is Lisa Kessler. I'm here on behalf of Cheers for Charity. We are a informal organization with Joanne and I who decided that we want to share some information and build more awareness for all the fantastic local nonprofits that are really doing amazing things in our backyard. So today we have another one to share with you. Joanne, great to see you.
Yeah. Hi, thanks, Lisa. My name is Joanne. I'm with Lighthouse Physical Therapy, and it is my pleasure to announce our guest speaker today, who is Amanda, and she's with the Monarch School. And we're looking forward to hearing all about your school. And please go ahead and share with us what you're all about.
Well, thank you so much for having me today. I love this group and love what you guys are doing. So we're really excited about the opportunity. And I know as a Leadership Seacoast grad too, this is really cool that you guys launched this. So thank you so much. So I'm with the Monarch School of New England, as you said. I used to be the speech language pathologist there, but my new role is Director of Community Engagement, which means I get to have the wonderful opportunity to share with all of you all of the great work that goes on and all about our wonderful students. So we're a nonprofit specialized day school for students ages 5 to 21 with significant disabilities. And when I say significant disabilities, that means the students who, for a variety of reasons, are not safe or successful in their public school setting. So that could be because they have a complex developmental disability, which means that the supports and services they need to make progress aren't available in their school district. They require a more intensive setting. That could be because they have complex medical needs and require a higher level of specialized nursing care than is available in the public school. Or that could be because behaviorally, as a result of their disability, they're having trouble staying safe and available for learning, which is disruptive to themselves or their classmates. So again, needing a more sort of therapeutic structured environment. So as a day school, we have students traveling from up to about an hour and a half one way to our 2 campuses in Rochester. We work with 30 different school districts across New Hampshire and southern Maine. So students are coming from as far away as Manchester, down by the Massachusetts border towns, the greater Seacoast, up to the White Mountains and over to York County, Maine. So we serve a really broad geographical area. And as I said, our students are traveling, I should say in typical times, right, before COVID, students are traveling for services for our Monday through Friday program. We do have a full-time summer session as well, which we actually just started in a new format, and I'm excited to share a little bit about with you later. But as I said, our students are ages 5 to 21. The New Hampshire Department of Education says that we can have 63 students, so that's what we have. We're always full with a wait list. And I think one of the best things about our program is that we, yes, are exclusively a school for students with special education needs, right? But we are taking in students that, you know, essentially failed in a public school setting, but we don't see it that way. We celebrate each student's individuality, their strengths, their abilities, and our entire philosophy is centered around providing unlimited possibilities for students with special needs. So we never look at what a student can't do. We look at what a student can do and what their potential is and what supports they need to get there. So it's a really dynamic and supportive and really creative place to work. Everything we do is collaborative and integrated and very functional. We have a robust academic, therapeutic, life skills, and vocational program so that we're always preparing our students for the greatest degree of independence possible. Some students will come to us for a very short period of time and then transition back to a public school, and other students will be with us until they graduate from special education at 21 years of age. So we're always looking ahead to, you know, what do they need to be as independent as possible. So to that end, we, as I said, have speech, occupational, physical therapy services. We offer vision services, nursing, and behavioral services, all of which are collaborative and integrated into either that academic life skills or vocational instruction I talked about, so that students aren't missing out on programming. We recognize everyone learns differently, So a student may be, receiving physical therapy on horseback as part of our hippotherapy program, but still working those academic goals in so that they're always learning all the time, whatever environment they're in. Of course, and our typical program, right, would be the day program with some of those supports I described. I think the challenge with COVID-19, we transitioned to remote learning in March, like every other school across the country. And I think what we really found is that special education students are kind of among the most vulnerable in terms of this being a model that works for them instructionally. Our teachers and therapists really went above and beyond to try to make it work. We embraced obviously Zoom, analog packets sent home, for students with visual impairment that needed high contrast materials that could then, they would follow along at home to like say their social studies lesson on Zoom. But it was a lot to ask of our parents. Like our students are in this out of district placement at Monarch for a reason. Because they need such a high level of support. So we've had to be really creative to make it work. Certainly, if now's a good time, I have a really nice short video I'd love to share, which sort of highlights some of the success stories of our students learning at home. It's just about a minute long, if that would be okay to share now.
Yes,
Yeah, awesome.
and that
Yes,
was one of the questions I was going to ask you, is some of the successes in your school. So it sounds like this video would be perfect.
Yeah, and then that'll let me, so this will be speaking to and illustrating, like I said, some of our students participating in that remote learning at home, and then I can share a little bit about what some of our next steps are. So let me see if I can share my screen here quickly. Oh, I think you just have to allow permission for me to share that. So if it's too complicated, I can always send the link later too, if that's easier.
it's asking about sharing my screen.
And just while we have a break and, she figures that out, sounds like you have quite a large staff there with all the different support systems to support. You said 63 students in your school?
Yes.
With all that support, you must have a very large support staff to be able to do that.
We do, and that's one of the differences that I would say between public school and our school, because we only do have 63 students. We can keep our class sizes very small, no more than 7 to 8 students per class, but each student does have either an educational technician or a one-to-one nurse with them, depending on their level of need. That's outlined in the student's IEP, their individualized education plan that every special education student has by special ed law. And we also have a teaching assistant and a teacher in each classroom as well.
So it lets me share my screen, but not yours.
No worries. So maybe I could just send the video.
Yeah, we
like
can link to it after.
Yeah, as a follow-up email, and maybe when you share our chat, you could include that too, and people could click on it if they were interested.
Yeah,
Cool.
we'd be happy to. Sorry about that.
No, that's okay. Last minute tech changes and all that stuff. I'm lucky I learned how to even just click into Zoom meetings, because I don't think I've ever video conferenced before this.
Yeah.
Another thing I just wanted to share briefly before I start talking about what we're doing now for summer session is Monarch is really unique, like I said, in our approach that literally everything is an opportunity or possibility for our students. And so to that end, we have a lot of unique programs that you might not see in a public school setting. For example, we have the only active registered horticultural therapy program in the state of New Hampshire, which is using gardening as a therapeutic medium to develop skills, social emotional benefits, things like that. So we're pretty proud of that program. Our physical therapists and our adaptive phys ed teacher do a lot of literally anything from adaptive skiing to adaptive gymnastics to, as I mentioned, horseback riding, hippotherapy, and therapeutic riding. We go kayaking in typical years. So literally any opportunity for, a well-rounded, productive life, we will seek out how we can make that opportunity happen. So I should probably pause and take a break just quickly before I talk about summer session. As I said in the beginning, I used to be a speech language pathologist, and we're prone to be a little chatty. So
That's great. So I'd love to hear what you're doing now with the summer. So it sounds like up until this program, you guys have just been exclusively remote. And now is this the first time you're actually getting students back into the school?
Exactly. So we were remote from March until the end of our school year in June. We always have a short break from June to July and then always have a full-time 4-week summer session. What we did, because we recognized that, as I said, some of our special education students were really kind of falling between the cracks, needed a higher level of support than remote was offering. What we've done is develop a very comprehensive hybrid model, which started on Monday. July 13th was our first day back. So we're bringing students on site in very, very small groups, 1 student per classroom. So for example, at our elementary and middle school campus, we have no more than 4 students in the building at a time. Those students will be on site for 2 to 3 hours to receive their speech, OT, PT, behavior, or vision services. And then we'll travel back to their home for academics, life skills, and vocational instruction remotely. So that lets us keep very small numbers of staff to deliver those services. That lets our students get back with, again, that higher level of support, start to get back into a routine with all of the PPE and cleaning and the social distancing measures in place. We feel like we've really exceeded all of, the current best practices as we can. And even just as a quick example, it's been so heartening to see our students as they come back, because of course our kiddos are so routine driven. We weren't really sure how they would do after this break. But as an example, a young man came in on Monday, smiled, happy, laughing, ran down to his classroom. At the end of his 2-hour block, he was working with his teacher, reading a story about going back home from school. And he's nonverbal, uses a tablet to communicate, like an iPad or communication device. And he independently went in and found the word stay and requested to stay 3 or 4 times. We didn't even know he knew that word. But he was so glad to be back at school. It was just really incredible that he was able to communicate how much he wanted to continue to be with us at school. So we're doing everything we can to keep our school community safe, but it's also so encouraging to see that, we can offer a little bit more and reconnect with our students this way. So.
Wow, that sounds like a really great way that you've transitioned now back into getting the kids back in there. I just had one question about funding. So you are a nonprofit. Are you, because you're taking on these students from the schools, are they funding part of their education? Are you required to then supplement with donations, or how does that work for your organization?
That's such a good question. So we're essentially a non-public, nonprofit school. And because students are entitled by law to a free and appropriate public education, if that can't be provided in their home school district, schools have to contract with what's called an out-of-district placement like Monarch. So that means that student's hometown or home school district is responsible for paying for that education since their needs couldn't be met in their home public school. So we receive a portion of our funding of our budget from tuition payments from sending school districts. We also receive payment for any services rendered like speech, OT, PT, as outlined in the student's IEP, that individualized education plan I referenced, which is paid for by school districts as well. So that covers a portion of our budget. Certainly development efforts and fundraising and philanthropy cover the majority of the rest of the budget because, as I said, many of the really innovative programs we offer, like horticultural therapy, or in typical years, any of those community integrated experiences, those aren't necessarily covered because may not be seen as educationally necessary by those tuition payments. We believe they're essential because that's, our whole philosophy, right, of unlimited possibilities and preparing our students for a well-rounded life in the community. So whether or not they're funded, we're always going to do our very best to make sure those programs are paid for through some of those other avenues.
Great.
That's great. Amanda, this is so interesting. I know what you do is incredible work. You work with, children or children and young adults that really can benefit from these services. And it's such a tribute to you to do this day in, day out. We're so grateful that you do it, and we're grateful that you shared it. If people want to learn more, how do they do that? If they want to, I don't know if there are volunteering opportunities, if there's ways to support you all, if they know people that may benefit from the services, how do they do that?
Thank you so much. And that's such a huge part of being able to speak with you today too, because like I said, we have 30 different school districts that we work with. So at the end of the day, I just want to make sure every community in town we serve knows about the work we do, because very likely there's a child in your community that attends Monarch or benefits from Monarch. So first and foremost, I would suggest going to our website, which is Monarch School, NE, like New England.org. And that's a really nice overview of who we are, what we do, some of our programs. In typical years, we would have volunteer opportunities. Because of the fragile nature of some of our students' health, we've really kind of had to scale back some of our, community visitors on site. So that piece is a little bit on hold for now. And certainly we've also had to scale back a number of our community events. We usually have, for example, a typical golf tournament or a really nice harvest festival in the fall, which is adapted and really inclusive for everyone. But we're sort of taking it day by day. So I think starting with the website would be wonderful. And I'd be glad to be a first point of contact too, because certainly just like we individualize for our students, if someone has a really unique idea or wants to get involved, I'd love to explore that further with them.
Fantastic. It's awesome. I love talking to you. I love, every time we've met and had conversations, it's fantastic. It's so interesting. So we're really grateful that you and your team all do what you do, and that you're there to support our community in the ways that you do. And I hope you check it out and get to know more about you. I'm glad we did.
Thank you so much for this opportunity. It was really nice speaking with you both.
Yeah, thank you, Amanda. I really enjoyed learning about it.
Thank
All
you.
right, thank you. Take care.
Bye.